Kent English Pelvic Pop. The symptom for inguinal hernia in adult men is often, a sensation of a pop in your pelvis, right off to the side. The symptoms have been straightforward for all of recorded history. The ancient Greeks and ancient Romans did hernia repair, and yet the diagnosis of the procedure couldn't be less clear. Communication and language are the only reasons. America has plenty of general surgeons. General surgeons are the specialist that treats hernias most commonly. The clarity of describing the condition is so vague because of the choice of Latin in medical science and also in medicine, which is totally unnecessary. And so we're making that right in Kent English Pelvic Pop, of which it's as clear as it is. Kent is the brand, English is the doctrine, and pelvic pop are the symptoms that folks will search for in search engine optimization. And there's some of the clearest signs and signals that any frontline first responder might hear. Symptoms, according to Johns Hopkins Medicine from their website: a bulge you can see or feel, aching pain in the area, a feeling of pressure, a tugging sensation of the scrotum around the testicles, pain that worsens with activities that add pressure to that area, such as heavy lifting, pushing, straining. The public health risk is significant. For those of you that care about the Olympic movement, every 4 years there's an American somewhere that misses the Olympic cuts only because they did not have a hernia repaired timely enough. I happen to have had a hernia for almost 2 years. I know that, it was part of my childhood. I spent, 10 years training for the Olympics, and then, in like the 12 to 24 months to the end of my swimming career, I had an undiagnosed hernia that was diagnosed as a muscle pull. The ambiguity of a muscle pull had me in physical therapy when a hernia is, a protrusion of your small intestine, out your inguinal canal. Out your pelvis. And I described it classically as a pelvic pop. I described that, to many physicians. And yet the physician, finding the right physician to describe that condition to was the bigger issue. Where a primary care doctor hearing those symptoms thought muscle pull, rather than thinking surgical indication. Whereas a sports medicine doctor at the university quickly identified it as a hernia. And it's, well, you have a hernia, and like I had a sensation, of, a very painful hernia that I lived with. Why is it important? It's important because the volume of Americans that are suffering with hernias and are looking for a place to get care has this huge disconnect where the physician residencies and fellowships have obscure names that a patient can't quickly understand, and physicians describe their scope of practice often in Latin, which defies the whole point of us having a country with a single language in English. And so the folks that have a hernia are numerous, are growing. Symptoms present in 66% of people with inguinal hernias. Often it gets worse throughout the day and improves when lying down. Again, helping match these patients with their physician is important. It's one of the most common surgical procedures. It happens to be very quickly, very easily repaired. The complication risks of doing nothing are large. There's risks of inflammation, obstruction. We're going off of Wikipedia. Strangulation, hydrocele, hemorrhage, autoimmune problems, and irreducibility. A lot of the root causes of weakening of the intestinal wall. Often it's overexertion. Often it's poor nutrition. There's very healthy folks. And, again, the diagnosis ambiguity in diagnosis originates from the disconnect between Latin and English. Again, in America, we can do a Kent English pelvic pop, so the symptoms real clear, and it comes up real clear in a search engine. 27% of males develop an inguinal hernia at some point in their lives. That's how large the market is. In 2013, about 25 million people had a hernia. That means that this company, Kent English Pelvic Pop, quickly has the opportunity of 25 million customers every single year. Reoccurs every single year. So it's like some 2 million every month. So it's a stable population. There's no reason to believe that physiological change will go away. They are procedures that carry an expense. Our business plan is to capture some of the revenues for that workflow and help educate patients and track quality over time and engage physicians to join us. With Kent English, English is the language of the liturgy rather than Latin, so it's clear. Kent English, pelvic pop, join us.